So this is me just going about a standard broadcast email, but the email builder is exactly the same. So all emails within Infusionsoft are built in blocks. So if we wanted to just drag and drop an image from the left, so this will be how it will look, it will not let you do that. All you would simply
Right.
have to do is copy where, so say you wanted the image after this email bit right here, just simply copy and paste, drag the email across. So I've copied that, I've backspaced it, drag the the image across where you want it, and then drag another text box below that image and then paste. It's the same with anything you want to insert from the left, so a video as well. If you wanted to put a button in there, so sometimes people use buttons to send people to specific pages on their website, we could do that also, but it's all built in blocks. It physically will not let you drag and drop it in the middle of text. You'll have to copy and paste. It's one of the frustrating things with Infusionsoft, but it is what it is.
Is the button, so let's say eventually we start putting Steve's newspaper articles on our website.
Mm-hmm.
Would I, like one of the emails, I could put the button and then that would link me to our
Yep.
website?
So all you would have to do is put the button, so the button's there right now. You would edit the button text here, so newspaper, Steve's newspaper articles. We would post the link, whether that be an email address, URL. So we post the URL there.
Okay.
We can play around with the text of the button here, the size of it, the color of it, and the same with the color of the actual button here as well. So I don't know if your clinic brand is green, we could go ahead with that green, and we could play around with the font as well.
Okay.
It was already in Arial, so I don't know why I selected Arial, but there we go, and the color of that as well. And then
Okay.
all that would have to happen is if I put one of these YouTube links in here, which I believe go to Paul's training videos, when I hit that button, it would take me to that link.
Okay.
You
Speaking
can
of Paul's
also,
YouTube,
sorry, you can also, so a hack as well, which you could apply. So you know well, you may not know, but the replay videos that we send out to all of Paul's clients. So right now, and how you got this link, I presume, was through the 4% Club replay, correct?
no, but I get what you're
Okay,
saying.
but replay emails are sent. So you can actually apply a tag to an action within an email. So we have a tag category in our business called Content Click. And within that tag category, we have tags for every single specific link we've sent out. For example, 4% Club Call number 41, which could be this week's, the 41st week of the year, whenever that is. I think it might be this week, actually. So we would have Content Click tag category, the tag of that specific call. And then what we would do is this tag button here, we would assign that Content Click tag to that specific link by hitting done after we've done it. And then we could see how many people had clicked on that specific link, because a tag would automatically be applied to every contact that clicked on that link. It's a way we spy on you all to see if you're watching the replays. But you could do that for your patients to see how many people are clicking on and going to the specific action you've asked them to do. Obviously, you can also do that in email reports as well for how many people have opened and clicked and taken action within that. But that's just specific to certain links if you wanted to send them to, I don't know, a training video you do within the practice or something like that. You look very confused.
I'm just trying to think of where I would, like, why I would implement that.
So you could,
I understand the purpose of it, but I'm trying in how it's applicable to what we're doing. I'm trying to connect.
So a warm lead, for example. So say you put some kind of link to a blog within. So we send a weekly email every Sunday, right, in the Paul Gough Physio Rooms, and say that you do a specific. So say this month, the month of October is Back Pain Awareness Month. So say we send an email this Sunday on a video that Paul has done with 5 easy to correct posture tips that will help back pain. Something as bizarre as that. And we include a link to that video or a screenshot. So we drag a video across into that email we could apply a tag to that specific video, a content click tag, back pain, posture video, something like that. So the content click would be the tag category. The tag would be something like posture video 1. And we could apply that tag to that video. And then everyone who clicks on that video, we can see who clicked on the video, because that tag will be applied to them. And that way we can see who is a warm lead, who is interested in improving their posture. And then we could personally send that list another email saying, hey, I seen you clicked on that video. What interested you most? Why do you want to improve your posture? Are you suffering from back pain? Something like that.
Okay.
So it's basically a way to define who is actively looking in your emails and taking action. So essentially that could separate warm leads from cold leads. That could separate a hot past patient to a not so hot past patient. And then we could specifically send emails to the people that are clicking on those, because they're a warm person. We want to get talking to those. So that could be a task within Steve's practice that, say, every Monday after the Sunday email, if anybody has clicked on that video or anybody has clicked on that specific action, we get on the phone with them, or we send them in a broadcast email if it's a large list, say 10 to 20 people, or if it's very few, 1 or 2 people, we get on the phone with those, or we send them a personal email and ask them what interested them in that email for them to take action.
Okay.